And I know a nurse personally right now who is at home where she's just monitoring patients' heart monitors, and she's making $93,000 for the year. Hey guys, it's the Bougie Nurse and welcome back to another video. If you're new, thank you for tuning in, and if you are already a subscriber, thank you for coming back. So in this video, I'm going to be talking about 20 nursing careers that you can get into outside of bedside. The beauty of the nursing field is that there are so many different fields and so many different avenues that you can get into that they never tell you about in nursing school. When you're in nursing school, they always emphasize getting a hospital job, you're practicing all these skills. They like to make you feel guilty, right? They'll say things like you're not a real nurse because you're not practicing bedside, or you're not working in a hospital. But what they don't tell you is that as a new nurse, when you're starting bedside, is that it's very challenging. You might end up dealing with anxiety. It can get stressful. You're dealing with being short-staffed. You have nurses sometimes who like to eat their young. And I'm going to be completely honest, sometimes you get treated poorly as a nurse. I've been there and I've been through it, so I'll be the first to let you know, do not feel pressured into working at a hospital, or do not feel pressured into getting a bedside position, because you have to get your skills up, and that's what they tell you. But I'm sorry to say, skills are overrated, because at the end of the day, what matters most is not developing skills. What matters most is your mental health and being happy where you work. And let me tell you something, honey. You are a real nurse once you pass your NCLEX. Period. Point blank. So let's get into the video. Number one is an aesthetic nurse, and what this nurse basically is a cosmetic nurse, and you're helping people through in-office treatments. So you can be doing injectables like Botox, or skincare treatments like chemical peels. And majority of these nurses either work in a private office or at a medical spa. And I've even known nurses to open up their own wellness center, and you can do this as an NP or an RN. Number two is a transplant coordinator nurse. And this nurse is basically in charge of the entire organ transplant process. So from the time the patient is picked to get the organ transplant all the way up until the surgery. And this career field typically requires someone to have some years of experience. So if you are already a nurse and you're looking for a change, this might be something you want to look into. Number three is the work from home nurse. And this is pretty much an umbrella term because there are so many different things you can do as a nurse while working from home. There's chart auditing, where you're looking through the patient's chart, seeing what they received and the care they received in the hospital. And there's utilization review, where you're reviewing the patient's whole care and making sure they receive the care that they need. And then you also have your telehealth nurse, and this nurse pretty much is communicating with the patient through phone or video chat or email. And I know a nurse personally right now who is doing telemetry telehealth nursing at home, where she's just monitoring patients' heart monitors, and she's making $93,000 for the year. I would love to work from home, but I have a very active toddler. Number four is the forensic nurse, and this is a nurse who works with crime victims to provide medical evidence and testimony that can be used in court. So essentially, you'll be working with patients who were victims of crime, victims of trauma, violence, abuse. So you are pretty much helping them get the support that they need and the justice that they deserve. So if you are a person that have a interest in criminal justice and also a passion for the medical field, this is both of them combined. Number five is the case management nurse, and this nurse basically is responsible for various elements that are involved in the patient's individual care. So think similar to like a social work. So if the patient needs to have a CNA in their house, or they need to get physical therapy 3 times a week, you're pretty much coordinating those services for them. Number 6 is a cruise ship nurse, and emergencies can arise pretty much anywhere and everywhere, whether it's on a boat or a yacht. So as a cruise ship nurse, you're going to be assessing situations and triaging, educating patients on whatever medical condition or concerns they may have. This can be something as mild as a passenger being seasick, or something more severe as someone who's passed out or is choking. But you're doing this all while traveling the world and essentially on vacation. that sounds pretty damn cool to me. Number 7 is a call center nurse, also called a telephone triage nurse. And what this nurse does is they receive phone calls from patients seeking medical advice. So you review their symptoms, you provide them with an initial assessment, and you can either refer them to the emergency room, to an urgent care center, or to their private physician during work hours. You are essentially providing nursing care over the phone, and that sounds pretty easy. I might look into that one. Number 8 is nursing informatics, and what this nurse does is they're coming up with technological advances in healthcare. So you could be trying to come up with a new Pyxis system, you could work at a university coming up with innovative courses. I actually thought of a creative way to pull meds, but I'm probably not gonna pursue it. Personally, I feel like nursing informatics is gonna end up being a big thing in healthcare, especially with COVID and the pandemic going on right now. I feel like someone's gonna come up with even more creative ways for patient interaction without actually physically being present. So if you have an idea of something creative or an innovative thing that can contribute to the health industry, you might wanna look into nursing informatics. Number 9 is a legal nursing consultant, and this nurse basically provides their expert opinion on medical issues. So it's kind of like a nurse and a lawyer combined, but essentially you're not defending or prosecuting anybody. You can find yourself reviewing medical records or investigating a patient's malpractice claim. More than likely, you can be working alongside an attorney at a firm, or you can find yourself in court representing insurance companies or other healthcare providers. Number 10 is private duty nursing. This type of nurse is usually caring for one individual patient, and typically you're either hired by their family or by an agency. You can do private duty as an LPN or an RN. I've heard of new grads being able to do private duty nursing. I've also met a nurse who did private duty for twin babies as a nurse, and she absolutely loved it. Number 11 is a vaccination nurse, and it is exactly what the title suggests. You are a nurse providing vaccine for members of the community. So whether it is a flu vaccine or other immunizations, you can even be given COVID-19 vaccines, being that we are in a pandemic. I recently saw a posting on Indeed.com for a job looking for a COVID nurse to only give vaccine, and it was $2,300 a week. So look into that. Number 12 is a flight nurse. So the flight nurse is a nurse who is trained to provide care for patients while they are being transported to a medical facility. So you can find yourself working with an air ambulance or medical transport services. With this career option, you do need to have some experience because you are going to be looking after critical care patients, providing emergency care and providing health monitoring. So if you are a nurse that has some ED or ICU experience and is looking for a change, flight nursing may be an option for you. Number 13 is a Disneyland nurse, and yes, you heard correctly. You can work as a nurse at Disney, and like I said before, emergencies can arise pretty much anywhere. So you'll be providing nursing care to the guests at the resorts. And according to nurse.org, working at Disney as a nurse is one of the happiest nursing careers, and I can imagine that. I can absolutely believe that. It sounds like a whole bunch of fun, and I just know it's going to be a healthy and positive work environment. So if you live in California or Florida and you want to work at Disney, maybe you can look into being a Disneyland nurse. Number 14 is home health nurse. So basically, the home health nurse goes to patients' homes to provide nursing care, and your caseloads vary. So you can see one patient for the entire day, or you can see up to 5 patients in a day, and you can do this as a new grad LPN or an RN. I personally have a girl that I went to nursing school with who left Bedside and is currently doing home care, and she loves it more than Bedside. She stated that it's less stressful and it's less physically demanding. Number 15 is a hospice nurse, and the hospice nurse cares for patients towards the end of their life. I personally cannot see people die, so this would not work for me at all. But my brother did this as an LPN for a few years and he had no issues. He said it wasn't stressful at all. It was pretty much more of an easy job. You can be a hospice nurse for a patient in the privacy of their own home or at a private care facility. Number 16 is a clinic nurse. So you are working as a nurse at a clinic. This can be an outpatient pediatric clinic. This can be a dermatology clinic. I personally started off as a new grad in an ambulatory care center. Sometimes it can be challenging finding a job in a clinic because majority of the nurses that work there are staying there till they retire. They have job satisfaction. I wouldn't mind working in a clinic again. I loved it. The only thing is it's 5 days a week, but I'm sure there's opportunities for working part-time. Number 17 is a school nurse, and you are a nurse that works at a school. Majority of the time this is going to be a middle school and your primary focus are going to be the students, but there are cases where you may see staff or may see even family during a school event. You can be hired as a new grad to do school nursing. I know right now they're looking for a lot of school nurses because of the pandemic, but they do prefer someone who has previous work experience. But if it's something you're interested in, you want to work with kids, definitely look into school nursing. Number 18 is occupational and environmental health nurse. So what this nurse does is they are responsible for observing and assessing healthcare workers in related to their health status when it comes to the job task and the hazard of the job. I've even known a nurse that worked at a factory as an environmental health nurse, and she only sees the workers when they get injured on the job. Number 19 is nursing clinical instructor, and we've all had clinical instructors while we were in nursing school. Some we liked, some we didn't, but basically they're preparing you for your role as a nurse, whether it's in a hospital, in a clinic, or a nursing home. They're going to be helping you with your care plan, helping you with your skills, and essentially it's not that stressful of a job. You may have students that can stress you out sometimes, but you're completely away from the bedside unless you have to do your clinical sites at the hospital, but you're not actively involved in patient care. Number 20 is the nurse surveyor. So basically this nurse goes around to different facilities and is just making sure that they are complying with federal and state regulation. It's pretty much like JCO, but you're doing that as a nurse. Alright you guys, so that concludes the video. Thank you so much for watching. My daughter likes to act up always at the end of the video. I don't know why, but if there were any jobs that I mentioned that are of interest to you, just look up what the educational or certification requirements are. You can also go on Indeed.com and search for that job in your state and see what the requirements are for your area. Don't forget to like, comment, and subscribe, and I will see you guys in the next video. This is why I can't work from home. This is exactly why.